Primary sclerosing cholangitis, also known as PSC, is an uncommon disease of the bile ducts. It affects around 6 per 100,000 persons. 2/3 of all PSC patients are male, and most patients get diagnosed around the age of 40. The majority of PSC patients also have inflammatory bowel disease, most commonly ulcerative colitis or Crohn's disease. The bile ducts, or biliary tree, are part of the liver. The liver is an important organ that is situated in the right upper quadrant of the abdomen. The outside of the liver is almost completely protected by the rib cage. The liver has many different functions. It plays an important role in the production, storage, and processing of nutrients, and it degrades toxins like alcohol and medication. Another important function of the liver is the production of bile. The liver consists of billions of liver cells, and they all produce bile. The bile flows through the bile ducts towards the small intestine, where it helps in the digestion of fat. In PSC, the bile ducts get chronically inflamed due to an unknown cause. Eventually, this inflammation leads to the formation of scars. Subsequently, these scars lead to narrowing of the bile ducts. This is what we call a stricture. If a stricture occurs in a main branch of the biliary tree, it is called a dominant stricture. The strictures of the bile ducts lead to obstruction of the bile flow. Subsequently, bile accumulates in the bile ducts, which leads to increased pressure. This higher pressure results in dilations of parts of the bile ducts. If bile remains stationary for long periods of time, the liver can get damaged. This can lead to scarring of liver tissue. We call this liver fibrosis, and in a later stage, liver cirrhosis. Around 70% of all PSC patients also have ulcerative colitis or Crohn's disease. This inflammation of the bowel is also called inflammatory bowel disease, or IBD. In Crohn's disease, inflammation can occur in the entire gastrointestinal tract, anywhere from the mouth to the anus, although its prime location is the last part of the small bowel and/or the large bowel. The inflammation in ulcerative colitis is limited to the large bowel. The reason that the majority of PSC patients have concurrent inflammatory bowel disease remains unknown. Symptoms in PSC patients are highly variable. Some patients have no symptoms for years, while others suffer from complaints from the moment of diagnosis. The most common symptoms are itching, fatigue, and sometimes fever. The cause of these symptoms remains largely unknown. We do know that obstruction of bile flow as a result of a dominant stricture can cause itching. Unfortunately, little is known about the cause and treatment of fatigue. Some PSC patients may have episodes with fever and cold shivers, which can originate from a bile duct infection, also called bacterial cholangitis. Bacteria from the intestine enter the bile ducts upstream because of the decreased bile flow. In a more advanced disease stage, liver cirrhosis can arise. In that case, the chronic inflammation of the biliary tree and the prolonged accumulation of bile have led to formation of scars and fibrosis. If this is the case, the liver cannot function properly anymore. Because PSC is rare and individual disease progression is unpredictable, it is difficult for your physician to give you an accurate prognosis. However, when you look at all PSC patients together, in the past we thought that half would have been transplanted or deceased 12 years after diagnosis. Since a few years, we know that the prognosis is a lot more favorable. Around 21 years after diagnosis, half of the PSC patients are still fine without a liver transplantation. Probably, with the current routine of periodic exams, prognosis will improve even further. Unfortunately, to date, the liver itself cannot heal from PSC. Only a liver transplantation can cure a patient from PSC. However, there are some therapies that can reduce symptoms. The most important one is the drug ursodeoxycholic acid, also called UDCA. UDCA changes the composition of bile. It makes it thinner. Because of that, bile can flow more easily through the narrowed bile ducts. Possibly, UDCA also has a slight anti-inflammatory effect. Also, there are some drugs that can reduce itch. If there is a relevant narrowing called dominant stricture in one of the main bile ducts, or there is a bile duct infection, it might be necessary to perform an ERCP. During an ERCP, a patient is sedated, after which the gastroenterologist uses an endoscope to go through the mouth and stomach to the entrance of the bile ducts in the small intestines. Following this, a small balloon can be inflated on the place of the stricture to dilate it. It is also possible to temporarily place a stent, a small, stiff plastic tube, into the stricture. Both these methods will dilate the narrowing and restore the bile flow. A lot of research is done in the field of PSC all over the world, and collaboration among researchers is growing. Several different theories around the cause of PSC are being investigated further in laboratories. One of these is the gut-homing lymphocytes theory, which hypothesizes that inflammatory cells that are supposed to be in the bowel instead adhere to the bile ducts in the liver. This causes inflammation of liver tissue. Another theory involves toxic bile acids. Here, it is thought that the normal protection layer of the bile duct vanishes for an unknown reason. Following this, bile, which is in itself toxic, damages the bile ducts, causing inflammation. Along these lines and other theories, potential new drugs are being investigated and are under development. At the same time, there are multiple large registries that send periodic questionnaires to patients to find out more about disease burden, quality of life, the natural course of PSC, and the factors that possibly influence them. PSC is a complex disease about which too little is known, unfortunately. Good cooperation between patients and international researchers is key to increasing knowledge. Over the past years, more and more has been learned about PSC, and this will enable development of effective PSC treatments in the near future and an eventual cure.